Today we have a really interesting guest, Linda Wood-Boyle from HomeStart.
Right. Linda has been the president and the CEO of HomeStart, and Linda has, even though HomeStart is in the nonprofit field, you've really built up quite an organization that works with families that are homeless or about to be homeless. So welcome to our show, and look forward to hearing more about your organization.
Thank you. Thank you. It's a pleasure to be here.
Can you tell us a little bit how you got involved with HomeStart and in your career and where the organization has gone?
Sure. I've been at HomeStart almost 15 years. I'm a social worker in my first life and ordained to United Methodist clergy in my second.
So is this third?
This is third. And for the last 20 years, I've been involved with working with organizations for the homeless. And when I came to HomeStart, part of what was so appealing to me was that we end homelessness. So we provide housing search to all of the shelters in Boston, about 50 of them, who refer their clients to us, individuals and families, and we're like realtors for the homeless. So a client or a family comes in and they say, where do you want to live? What can you afford? What are the barriers to you getting there? Not unlike what a realtor would do.
Right.
And then our housing advocates work with folks to get them placed. We place about 500 households a year in permanent housing.
Excellent.
And
Wow.
then what's equally important, I think, with our mission is that we help folks stay there. So we don't just have a new mom who's never had an apartment and just plop her in this apartment and say good luck. We work with them on budgeting and maximizing income, getting their kids hooked up to services in the community, how to be a good neighbor, how to be a good tenant, work with them, as long as they need to really get settled into a rhythm.
Do you see any primary reasons for the homelessness, and is it increasing in the past few years?
There's a variety of reasons for homelessness. We've done a good job at, in the last probably 5 or 6 years, at decreasing the number of chronically homeless, which most people think of. When you think about homeless, you think about the man or the woman on the street who is mentally ill or under some kind of substance abuse. We've done a good job working with the street population. The family numbers are astronomical, just astronomical in terms of how much they've gone up. Massachusetts is the only state that guarantees shelter for families who are income eligible, which is why you hear about all the families in the motels.
Right.
Because the shelters are full. It's just such a high cost of living.
Right.
Boston is, it's very expensive. And to find, housing that one wage earner or even two wage earners at minimum wage can afford is a real challenge.
You started with, I guess, a budget of $1 million with Somerville, and now you have 60 employees, staff members, and a $7 million budget. So it sounds like in the last I know for myself in the business community, homeless is finally, it's not been a sexy charity, but finally it's resonating in the community.
Yeah, and I think that's partly because agencies like HomeStart and many others have proven that it's much more cost effective to address it than to just pretend it's not there or continue to, Boston Healthcare for the Homeless, which is one of our partners, did a study of 105 folks on the street over 5 years. Over that 5 years, those 105 folks made over 18,000 visits to the emergency room. That's not the x-rays, that doesn't include, the costs, the absolutely amazing costs. We went to Mass Health, and this is just the model that I think it's making it more, making people pay more attention. We went to Mass Health with Boston Healthcare for the Homeless and said, look, Mass Health, that's costing you, all these uninsured folks. We'll take 24 of this cohort. We'll put them directly into housing. You provide the case management and the health care, and we'll prove to you how much money you save, okay? After 2 years, there was a 66% reduction of those 24 folks using the emergency room because they're not using the emergency room as their primary care.
Right.
They're also not dealing with frostbite or malnutrition, and they're dealing with their diabetes and preventive care.
Right.
All of that kind of stuff. So I think, agencies like ours and many others, like I said, are really sort of trying to waving to people saying, look, it's much more cost effective. Never mind sort of the moral imperative around getting people housed or keeping them housed. It's like, okay, business community, this is costing all of us a lot of money.